Hi, everyone. Thank you for joining us today for our webinar. We truly appreciate you joining us live. We're hoping to be able to keep this video short and sweet, but we wanted to give you a bit of a rundown on how to navigate certain technologies. Now, for those who are joining us in the future, we're going to have timestamps on this video, which means that you can fast forward to any section of the video that you'd like. For example, we're going to be discussing our YouTube channel, how to make a Facebook account. We'll talk about how to make a Gmail account. And we're also going to be talking about a number of different apps which you can download to help you stay connected with others, as well as to take control and manage your own health. So without further ado, we'll get started. So there's sort of this black box when it comes to technology. There's this big space, there's this big world out there that many of us don't really know a whole lot about. And we're hoping that by the end of today's webinar, you'll be able to navigate technology just like Garfield is able to navigate his TV set. So before we go into our first topic, which is discussing our YouTube video, I just wanted to give a brief reminder for those who are joining us live on our WebEx. If you are interested in, is everyone able to hear me right now? Perfect. So if you are interested in speaking up at any points, and if you have any questions, you're more than welcome to turn on the mic. You just have to click this little button right here and you'll be able to ask your question and we'll be able to answer it. If you're less comfortable with speaking live, you're also more than welcome to click the chat function where you can type in your question and we'll be able to address it for you. Now, if you're joining us on YouTube, there's also a chat function where you can ask any questions that you have. And again, I'll be monitoring that chat so that any questions that you have we'll be able to address throughout today's webinar. So a brief rundown of the things that we want to talk about today. We're going to start off by discussing our YouTube page, followed by our website, which we are currently working on. We're then going to talk about how to make a Gmail account for you to be able to stay in touch with people through email. We're then going to discuss the various Facebook groups that we have and how to make a Facebook account. We'll talk about various ways to keep track of your health. And finally, we're going to end with some important information on lifestyle changes and technology, including some interesting apps which you're more than welcome to download. So the first thing that we wanted to discuss, again, is our YouTube page. Now, we have a lot of questions about how to navigate our YouTube page, and we were hoping that we can use this opportunity to briefly be able to explain it. So the first thing you need to do to find our YouTube page is to go onto the internet and type in www.youtube.com. There you'll be met with a search bar where you can put in any information that you wish. To find our channel, all you need to do is type in Greg Curnew or Dr. Curnew, and it'll be the first thing that shows up. Here you'll be able to see all of the videos that we currently have available, which is currently over 200 videos on a range of different topics. To be able to look at the videos, all you need to do is go down and browse the video section. All you have to do then is scroll using your mouse or your finger if you're on your phone, and you'll be able to see all of the videos that we have available. Now, to keep things organized, we also have organized a lot of our videos into playlists. Here you can find many different topics categorized based on the particular category. For instance, we have videos on managing your hypertension. We also have videos for cooking, technology, breathing club, and this is just to name a few. Now, if you are joining us on a Thursday or a Friday, you'll be able to see the upcoming webinar for this week. Now, as you may know, we have weekly webinars on Fridays at 7 o'clock, where we discuss a range of different topics, and today we've decided to dedicate our time to discussing technology. So if you're ever curious to know which video that we'll be discussing or what topic we'll be discussing, you're more than welcome to click that button at 7 o'clock, and you'll be joining us live on YouTube where you can ask any questions that you may have. Now, if you're looking for a specific topic, for instance, I was interested in learning about cholesterol, all you need to do is go to the little magnifying glass on the YouTube channel and type in that keyword. So in this case, we typed in cholesterol, and here you can see all of the videos that we have available discussing cholesterol. So we've done a live weekly webinar. We've also discussed statin medications, and here you can see 6 years ago, Dr. Curnew also did a seminar discussing the debate on cholesterol drugs. Now you can use this for many different keywords, not just cholesterol. For instance, if you're interested in learning about hypertension or managing blood pressure, All you need to do is type in those words into the search engine, press enter, and you'll see all of the videos we have available to you. Now, our video schedule may be subject to change, but as of today, our current schedule is that we post a shorter Wednesday video, which is pre-recorded. And for those who want to join us live and ask any questions that you may have, we have those on Fridays at 7 o'clock, which today is what we are now dedicating our time to, discussing technology. On our YouTube channel, you'll also see that we have these videos organized into categories. We have our pre-recorded series on our YouTube channel, which are shorter videos, and we have our live series, where we discuss things in much greater detail. Now, we're not the only YouTube page available to you. There are many different great resources available to you for you to explore. We wanted to provide 2 recommendations here for YouTube channels that we think are really interesting, engaging, and present their information in a fun and enjoyable way. The first one is Doc Mike Evans. Here is sort of an example of some of the recent videos that he's uploaded. You'll see that a lot of his videos are more pictorial based. So he has made a living out of making Draw My Life videos, or videos that explain things primarily through images. It's a great way to be able to learn from a range of different topics, not just focused on cardiology, but in this case you can see they talked about things such as brain injuries. In this case they talk about heart attack, and here they talk about alcohol consumption. Now, another great YouTube channel that we highly recommend is one called MedLife Crisis. Now, this is some of the videos that he's recently performed. You can see that one of them was a 10-minute explanation discussing statin medications, all the way to discussing the debate on vegan and keto diet. What I liked about these videos is that they're short, sweet, and they're presented in a way that's really digestible and easy to understand. It's primarily just the doctor speaking on a one-on-one basis, explaining a certain topic to you. And I found them very informative and highly encourage you to check them out as well. So now we want to briefly discuss the website that we are currently working on. As you know, we are constantly working on various projects, and one of them is creating our new website. So we currently have a temporary website up, but we're hoping in the near future we can create a website that combines all of the things that we're currently working on at the clinic, all in one space for you to access. So what we're going to be doing is creating a Squarespace website. Now you can see this is just a template example. We're not into the fashion industry, as you know, but I briefly wanted to discuss some of the main features that we're hoping to implement in this future website. So on this website, we're going to be focusing on highlighting our YouTube page, which we're constantly working on and trying to improve. We're going to be discussing various health resources. We're going to be discussing our Facebook groups that we have available. We're going to be discussing the many different focus groups. We're going to be discussing the app which we are currently working on developing. And we're also going to have more information such as infographics, which discuss a range of different topics from blood pressure to cholesterol to everything in between. And while we're on that topic, we just wanted to briefly touch upon our app which we're currently working on. Now, this is something that we hope to add and potentially launch sometime in the summer, and we're hoping to have a number of different key features associated with the app. It includes appointment reminders, medication lists, and information. We want to also include many different clinic resources and also give you easy ways to access and sign up to the many focus groups and workshops that we have on the go. So that's something that you can keep an eye out. And as soon as we release it, you'll be sure to be the first person to know. We'll announce it on our YouTube page, our website, and we'll also send it in our newsletters. Now, I want to just take a moment to also discuss how to make a Gmail account. Now, email is very important, and we've had a lot of questions about how to actually create an email account for us to use. So we wanted to briefly discuss and touch upon how you can make one yourselves. It's a fairly simple process. First, you visit www.google.com. Then what you'll do is you'll see this grid shape in the top right corner. What you have to do then is click the Account button, click Create an Account, and here you'll be able to input the information which they need to be able to create your Gmail account. It'll primarily just ask you for your name and a password to be able to get into your Gmail, as well as what username you would like to create. make sure that whenever you are making your passwords and your username, that you write it down in a safe place so that you don't forget in the future. Now, with this email in mind, what are some things that you can use with it? Well, one of the main things is that you can subscribe to our YouTube channel. So when you are signed into your Gmail account, you can then go onto YouTube and click that red button in the top right corner. And you can also click the bell button, which shows up once you click that button, to be notified whenever we post a video. Now, that's not just for our channel, that's for any channel that's of interest to you, whether it's related to health, entertainment, diet, lifestyle, anything in between. And next, I'll pass it along to the next volunteer who will be discussing the many different fake Facebook groups that we have going on at the clinic.
Great, thank you, Jared. So I'll take it from here for a bit and talk about some of the Facebook groups we have. Just to introduce myself, my name is Sonia and I'm one of the volunteers at the clinic. We'll get into it. So over the past couple of times, we've actually created some groups online through Facebook, and these are focus groups that you can join to essentially meet other patients and get more resources. So we'll go into exactly how to start a Facebook account first. So to start a Facebook account, which you'll need to join these groups, you would first go on to www.facebook.com, and you would essentially click the green button that says create an account, as you can see here. Once you have clicked that, it'll essentially ask you to enter your information in, so things like your name, your password, and even things like your date of birth if you're comfortable doing so. And once you have all that information entered in, you can click the green button that says sign up. And once you've done that, Facebook will essentially send you an email just verifying that it is you who is actually signing up for the account and not somebody else. And you would essentially go into your email, into your inbox, find that message from Facebook, which should be at the very top, and you would essentially confirm your account, and you'll be able to log in to your account with the same information, such as the email and password that you registered with. So what exactly are we doing on Facebook? Well, first of all, we have a Clinic Live group on Facebook. And this is essentially a Facebook page where we post a lot of the videos that we have upcoming. So for example, we'll post our videos on Wednesday as well as the webinar links on Friday, along with any other exciting announcements or resources that we would like to share with you. And to stay updated with this page, you essentially have to click the like button that you see here. And this like button will make sure that you get notifications from this page, and that this page, all the updates pop up on your normal Facebook feed. So this is a really great resource for you to look at. Now to find this page, moving on to the next slide, you'll see at the top of Facebook that there's a search bar, very similar to what Google has, and you essentially want to type in Greg Curnew Life Group. And that's when you'll see the page. This is what it looks like with the logo and the image, and there's where you're going to click that like button again. So these are just some examples of past updates we've had, so you can see that we provide descriptions of the videos, the links to the videos itself, and you can also feel free to like our posts if they're something of interest to you. You can comment on them if you have something exciting to say, and you can even share them to your own family and friends and spread the information as much as you can. Now, as I mentioned, we've started new focus groups specifically on Facebook, and these are essentially private groups that connect you with other patients who might be working towards very similar health goals that you are. And so some of these groups that we've started or are planning to start include things like the weight loss group, the smoking group, the mindfulness and movement, as well as cooking club. And so if you're interested in any of these groups, you can email us at drcurnew232@gmail.com to sign up. And we'll just show you an example of one of these groups in the next slide. So for example, this is the weight loss group, and they meet every Tuesday nights. And you can see that there's 75 members in this group, so that's a lot of new connections that you can build with other patients, volunteers, and the rest of our team. And it's a private group, so anything you share here will not be shown to anybody else outside of the clinic environment. And so there's a lot of good support you can build here, a lot of great connections and resources. So if you're interested in joining this group or any others, please do feel free to check that out and ask us if you have any questions.
So this is a good time to introduce another focus group which we're hoping to implement in the near future. We understand that us explaining technology can often be confusing, and you need to hear it a few times, and we are willing to provide that one-on-one support. So something that we want to implement is for the first Saturday of every month at 11 o'clock, we're going to be doing a Zoom session to go over various things that we discussed here today, such as how to access YouTube, how to use your Facebook account, how to use your Gmail account, and even ask any general questions that you have. It's a good opportunity to get those questions that you have answered so that you're able to get the most out of technology, not just to stay social, but to also use it as a resource to help prioritize your health. And so if you are interested in signing up for this, there are a few options for you to express your interest. Either you can send us an email at drkearney232@gmail.com, so just make sure that you put the @ in between. And also, you can even fill out the Google form either in this video description. So if you are joining us on YouTube, you'll see that there's information below the screen itself. And there you can click on the link to sign up. Those who actually joined us through our newsletter, we have also linked that in the newsletter as well. So there are multiple different ways in which you can express your interest. And again, we'll remind you at the end of the video of these different ways, just so that you don't forget. And here's just a brief outline of what the Google form looks like. It essentially breaks down what we're hoping to provide to you. So we're going to be giving you information on how to access our webinars, access your lab results through DynaCare or LifeLabs, for example, how to access the App Store and download apps, and much more. So we want to do this every Saturday, the first Saturday of every month, to anyone who needs that one-on-one support. And all we essentially need from you is for you to share your name, your email, and phone number so that we get in contact with you, how you'd like us to support you, whether you'd like to be joining a large Zoom session with others to ask your questions in an open space, or if you'd like one-on-one consultation with a volunteer who will be able to answer any questions that you have. Another question that we do ask in this newsletter as well is if you would like to sign up for future newsletters so that you can stay informed on all of the videos and focus groups which we are working on. So again, if this is something that's of interest to you, you just need to fill out the Google form in the video description of this video. And again, we'll remind you at the end of today's webinar as well. And next, I'll pass it along to another volunteer who's going to be discussing the important topic, keeping track of your health.
So I'll be starting us off here. So essentially, keeping track of your health, there's a lot of different things that go into someone's health, whether it's medications, diet, exercise, and so in this section we just want to break it down one by one and also try to see how we can use technology to help with some of that as well. So the first thing that we wanted to touch on was talking a little bit about medication errors. And so what's really surprising, and what I have written here, is asking if you are a medical error. And I say that because every year there's around 7,000 preventable deaths that occur in America simply because of medication errors. And a lot of the times when you come to the clinic or you speak with one of our volunteers, you'll notice us ask you for your medication list. And I know that this can be frustrating for some people, or it's tedious to go grab the list, but we want to touch on here why it's so important to do so. So moving on to the next slide into some of the common causes of medication errors. So a lot of it happens, first of all, with miscommunication. So especially if there is misunderstandings between you and the rest of your healthcare team, this could be really detrimental and cause an error within getting you the right medications you need. It can also happen with similar medications. So, it's confusing sometimes, especially if you're taking a lot of medications, if they have similar names, similar doses, or even if they look alike. And so that's another big cause of it. Similar along those lines is abbreviations. So a lot of medications have abbreviations that might be missed. And also in the end, individuals just feel very overwhelmed with the medications they have and keeping track of it. And that's also another reason for why some of these errors occur. Now, the good news is that even though there's lots of reasons why they can occur and they have a lot of harm to your health, these errors are 100% preventable, and we want to show you how you can prevent them in your own life. So the first and most important way is to keep a medications list. And even though this might be a little bit of work on your end, it really does ensure that we have the right and most updated medications in our system and that they're the most accurate. And if you don't do this, it can really lead to harmful diagnoses or perhaps mixing of medications or side effects that you might not want in the end. And so the more updated your list, the better. Secondly, we don't know what medications you might be taking outside of our clinic, so for example, prescribed by other doctors or anyone else. And so again, that list is really helpful to make sure we have everything correct on our end. And finally, it allows you to be involved in your own health. By having a list, you'll know exactly what you're taking and how often, and so you'll really feel in charge of your own health and your own condition and be able to make your decisions that way as well. Now you might be wondering, what does a good medications list look like? And so here we have an example of what that might look like for you. So you can see that there's a simple table where it just lists the name of the medication, the dosage and the frequency, who prescribed it, as well as any other notes that you might have about the medication, such as additional side effects or your own experiences with it. And this is really important that when you have a list like this, you're continuously updating it whenever you can. And if you don't want to make your own list, it's also possible to get a medications list from your local pharmacy when you do go, and they can actually print out a list for you with all this information, and this makes it even easier for you every time you do visit. Now, what does a good medication list actually include? Well, again, you have things like the name of the medication, so you want to include generic names that you would hear often, and then brand names as well, and so sometimes medications can have both of these, and make sure the spelling is correct and you're not getting confused with any other similar medications. The second thing you want to include is the dosage and the frequency, so how often are you taking it, and how much of it do you actually take? And then lastly, the purpose of the medication, so what exactly are you taking this for, and what is it helping you with? And this last one is really important because, again, it allows you to understand your own health better and really get a better grasp of your own condition. Now again, going back to the idea of technology and how are we going to use it to help us with our medications, well, if you have an iPhone or even an Android phone, for example, a lot of phones nowadays actually have reminder apps that you can use. So here I've shown an example of the iPhone reminder app, and the icon that you see on the very left is what it looks like on your phone. So if you're on your home screen, you find this little icon with the blue, red, and yellow circles. You can essentially open it up, and you'll see here that it essentially shows an inbox and a bunch of rows where you can actually go in and type your reminder. So for example, here on the screen it says testing, and essentially if you click that little I button on the right hand side, it'll allow you to enter in things like what this reminder is for, when the app should remind you, any other notes you have, and also the priority of this reminder as well. So for example, you could go into the reminder app, type in your medication that you have to take, you can even type in notes about the dosage, the frequency, and then if you continue to click on the details, it'll ask you, do you want it to remind you every day, every week, every 2 weeks? So you can really tailor it towards what you need. And you can also see that it asks you about how many days and also how many minutes before you would want the app to actually remind you. So it's a really great way to stay on top of your medications and really use the phone to help you do that.
Great, thank you, Sanya. And now I just wanted to come back to the idea of technology and medications. There is a great new thing that we recently learned at the clinic in partnership with Shoppers, and what they're essentially doing is on their website you can now organize your refills online. So we wanted to briefly just provide a bit of a rundown on how you can actually do this so that you don't run out of refills in the future. So if you are currently a customer at Shoppers, you can take advantage of this resource to basically stay on top of all of your medications. So how do you essentially use this resource? Well, the first thing you need to do is go on your laptop, your phone, your computer, and type in mypharmacy.shoppersdrugmart.ca. We have that listed right here as well. And when you're on the actual website, this is what the interface will look like. On the top right, you're just going to go over to create an account, where there you're going to add your email, password, and again, whenever you add your email and password, Make sure that you are recording it so that you don't ever forget it in the future. And then you sign up, and that's how you essentially sign in and create an account. Now, what does this essentially offer you? Well, above all else, it provides you with the opportunity to get auto refills. So you get to refill your prescriptions automatically whenever you're out. You'll be notified essentially whenever you're running low on your prescriptions. You'll be able to actually get them renewed by your pharmacist, and then you'll be able to skip the line whenever you actually go to your pharmacist, so you can just pick them up. Now, another thing as well is if you are ever concerned about a family member, for example, and their ability to stay on top of their medications, the great thing about this is it also allows you to manage a family member's prescriptions as well. So you can sign into other members' accounts all through your account to be able to also get their prescriptions auto refilled and picking them up as well whenever they're in need of a refill for their medications. Above all else, this provides a fast and easy way for you to be able to get your refills, your prescriptions refilled all at once and all online, which is a major convenience these days when it's a lot more difficult to go out. Now, how does this auto refills work? So essentially what you'll do is you'll sign up. So in addition to actually making an account, you'll need to, of course, share your provincial health card or health benefits card. You also need to be a customer with a valid prescription of Shoppers Drug Mart. Then what you'll be able to do is through the website, you can turn on auto refills. So you can choose which prescriptions you'd like to get automatically refilled. And there are other controls which you can select. You can control the settings for each prescription. And you can also cancel these auto refills at any time as well. For example, whenever there's a change in your medications prescribed by various doctors. And the great thing as well is you get a notification through your text message telling you when you need to pick up your medications when you are running low. You can again choose to get them through a text message if that's more convenient, or if you recently created a Google account or you found our tutorial of making a Gmail account helpful and you've been trying to test the waters on your Gmail account, you can also redirect all of the messages through your email so that you can have it organized right there. And the great thing about this feature is it helps you to skip the line. So instead of having to go in Shoppers and wait for other customers to be taken care of by the pharmacist, you can actually essentially just go in and pick up your medications at the pickup counter. And of course, if you have any questions or concerns, you can always ask them to your pharmacist at that time. And I again mentioned how you can manage a family member's medications as well. So how exactly do you do that? Well, essentially, whenever you sign up, there's also going to be a feature on the actual website where you can add a family member. So it's going to ask a few questions to verify that this is your family member. It's going to ask some personal information, probably their email, probably their health card number. And then you can also be able to manage that family member's prescriptions through this account that you created for yourself. So not only will you be able to manage your own prescriptions, but also a family member's as well. And so there are many different features, but just to name all of them again, you can submit refills online and skip the wait whenever you go into the store. Refill prescriptions automatically with the auto refill option. You can receive email reminders or text messages whenever you need to pick up your medications. And the great thing about this as well is it provides you with a full medications list so that you can essentially keep track of all your medications through this app if that's the most convenient way for you to do it. So if this is something that you would find of benefit, I highly recommend that you either come back to this video in the future to be able to go through this tutorial that I explained to you again, or if you ever want us to walk you through it as well, please just send us an email to drkernew232@gmail.com. We'll be happy to book an appointment with you to help you through this process.
Okay, so keeping a track of your health is incredibly important. In addition to keeping track of your medications, it is also good to keep track of your recent hospitalizations. So the clinic usually has access to hospital records within the Greater Hamilton area, but we don't have access to records outside of the Greater Hamilton area. So it is good practice to keep a record for yourself. And some things you can record are as follows, such as why did you go to the hospital? When were you admitted and discharged? What did they tell you? Are you feeling better? And are there any medication changes? Now, if you have issues with blood pressure, it is recommended to purchase a blood pressure monitor. It is important to check your blood pressure frequently, at least 3 times a week. And if your condition is more severe, it is recommended to check it 2 times every day in the morning and evening. This is because the single reading at the doctor's office is not very reliable. As you can see, your blood pressure reading in the doctor's office may be inaccurately high. If you have records at home, this can be very useful for the doctor to accurately assess your blood pressure. So how do I measure my blood pressure? Firstly, you should take 3 blood pressure readings in a row, and you would discard your first reading, and with your second and third readings, you take the average of them, and you can do the same for your heart rate. So in the example below, we discarded the first reading and averaged readings 2 and 3 to reach our final reading. Okay, and when taking your blood pressure, try to be seated quietly for at least 5 minutes. Do not have coffee or smoke 30 minutes prior to taking your reading. Sit in a chair with your feet flat on the floor and arms supported with your elbows at your heart level, and do not speak during your measurement. Now, some of you might have to do some lab work, and to find out more about your results, simply visit lifelabs.com and click on the See My Results tab. Results are typically updated within 24 to 48 hours of testing, and this is just an example of something you might see on your screen. And we have several pre-recorded modules for you to learn more about how to use and access results on LifeLabs. So you can find this on our YouTube channel by just searching up LifeLabs and DynaCare, and you would be able to access our pre-recorded modules.
So next we're going to be talking about making healthy lifestyle changes. So there are a lot of apps that you can use to help you make these changes, and that would be doing things like increasing your activity level and also eating healthier. So the first app we're going to talk about is called Fitness Buddy, and this is an app for both exercise and healthy eating, so you're able to track your progress throughout. And so for your workouts, you can pick the goals that you want to achieve. So for example, like if you want to build up your arm strength, core strength, or cardio, you can like pick that on the app. And the app has prepared workout regimes that focus on that specific goal. And each program will contain a schedule with different workouts that you can try per day until you reach your goal. And it contains different workouts that incorporate different pieces of equipment. So that would be things like resistance bands, medicine balls, and dumbbells if you want to specifically work out using those. And if you don't want to choose any of these workout programs, you're also able to build your own workout schedule using the exercises that you prefer. So you have either of those 3 options. And when you sign up, Fitness Buddy will ask you some questions about your goals and your lifestyle habits, and then recommend you a workout plan to follow based on that. And when you do pick a workout program, Fitness Buddy will show you the different exercises you will do and a video on how to do them. And they'll also tell you how many repetitions of the exercise that you should do. One cool thing about the app is that it has a music playback feature, so you're able to listen to your own music while working out. And to track what workouts you're doing per day, Fitness Buddy has a calendar feature to show you what you've done and what's coming up for you. And another feature that the app has is a meal planner component. So it shows you meal plans that you can follow and recipes to try based on a specific diet plan, including paleo and keto. And you can also track your body metrics throughout this entire process, and you're able to keep track of your body measurements, so that would be like your weight and chest, arm, and waist circumference, and input them onto the app. And the app will give you like a nice graph of your progress, so you can see how you've been making changes. And you do have to pay for the app. It's about $40 a year, which gives you full access to the app and email summaries of your workouts and advice for the future. And see, if you look at the next slide, you can see some examples of workout plans that they have showing like upper body and lower body, the repetitions that you have to do, and the schedule. And the next one shows you like the different meal plans that you can have, as well as the record keeper of your different body measurements. And the second app we'll talk about is Noom. So Noom uses the psychology-based approach to change your eating habits for the better. And with this app, it doesn't tell you to cut out any specific foods to help you lose weight. And instead, it helps you change the way you think about how you eat. And Noom's healthy lifestyle program uses food, exercise, and mental health aspects built in to ensure that you stay fit or lose weight depending on your goals for the long term. So it's both an app and a website. And the website is just noom.com, and if you search on the App Store, it's just the same thing, Noom. And when you start off with the program, you download the app or visit the website and pick your goal, so that would be get fit or lose weight. Then you enter your height, weight, gender, age, goal weight, and other aspects of your life into it. And once you're in, you're going to log your meals and snacks every day. And the app is going to give you feedback on your food choices to steer you towards healthier options. You can also log your exercise, and the app will also give you exercise recommendations to help you become more active. And this program tries to be super comprehensive. You can see articles about nutrition, weight loss, and exercise, and they also offer you challenges to keep you going. And the program can also be tailored towards managing diabetes if that's something that you want, if that's something that you have. So to help you make healthier food choices, Noom is going to color code foods, and green foods contain foods are higher in calories and should be eaten in moderation. So there are green, yellow, and red foods on the screen, and on the right image you can see somebody's experiences with Noom, how they started off eating more red foods, but then started eating more green foods as they used Noom more and more. As well, you'll get personalized encouragement and guidance from Noom's coaches to keep you on track and help you reach your goals. They'll send you messages every day to keep you motivated and remind you to continue on with your journey. And so the cost for this program, after a free 2-week introductory period, it costs $59 a month or $129 for 3 months, and the plan automatically renews. If you want to try out more apps, we've discussed 2 fitness apps, so that's Strava and MyFitnessPal on one of our earlier webinars. And Strava is an app used to keep track of your runs and bike rides, and MyFitnessPal is a calorie counting app for weight loss.
Great, and the next app that we just wanted to briefly touch upon is sort of just a screener examination, which is designed to assess your cognitive functionality. And essentially this screener is for individuals, for example, say you're having trouble remembering your medications, and this is becoming a challenge to you. And if you wanted to actually get a cognitive assessment, this is a standardized app which you can download to be able to answer the questions that they have. And then it's rated on a scoring system, so 1 to 2 are people that are unlikely to require further assessment or follow-up. 3 to 4 require further assessment or follow-up, which will be based on the judgment of a clinician, such as your family doctor, as well as available information on geriatric and social service resources available to you. And if you're in the upper echelon of 5 and 6, then it is recommended that you have further assessment or follow-up, which is highly recommended. Now, we just wanted to briefly touch upon this because we understand that taking control of your health is never always easy, and sometimes you may notice that you're forgetting something. So if you wanted a standardized approach to test and evaluate your cognitive function and whether you may deem it a concern or not, this is something that you can consider trying to see where you score on the rating system. So yeah, I'm not sure if I can hear you right now. One second. I'm not sure. Do you want to try again? No, okay. I can't hear you, but I suppose I can take this one on. Perfect. And you can let me know if I do it justice. So we just wanted to show you a brief video on YouTube, actually. This is sort of a new technology which is not meant to replace clinical assessment evaluation, but can be used in totality with a clinician. So for example, you can use this to measure your ECG, and if it comes up with a concerning result, this can be something that you approach your family physician with or your cardiologist with so that you can actually have further assessment. Now, we wanted to essentially play this video for you so you can sort of get an appreciation and understanding of what this new technology is. So that provided a bit of a summary of what the new Kardia Mobile is. This is something that I believe Dr. Carnew is going to be getting his hands on a few in the near future, and we'll be discussing a little bit more in future webinars or in future emails about the potential for us to share this with a customer, with a patient who is actually interested in trying it out. Again, the Kardia is not meant to replace clinical assessment, but as you saw in the video, it can detect things such as potential atrial fibrillation, which might get you into the doorway of our cardiology clinic where we can do further up assessments and do some more tests on your heart to make sure that everything is good and strong. So we wanted to briefly introduce this, and in the near future you'll probably be hearing a lot more about it as we gain more understanding of it and we begin to use it in our own practices. And if this is something that you are interested in using, you're more than welcome to investigate it online by simply looking up Kardia in Google. And Sandy, was this your slide as well? Was it yes?
This is the slide that has Strava on it and MyFitnessPal on the right. And they're shown in the webinar using technology to maximize your health.
Perfect. So if you want to learn more about both of these apps, you're more than welcome to look up on our YouTube page using technology to maximize your health. We've discussed this app previously, and we encourage you to have a look at it as well, where we go into it in a little bit more detail, but these are more exercise-based apps to help you take control of your health.
Alright, so we're going to finish off here by talking about COVID Alert, which on the next slide we can see the logo, so that's kind of what to look out for in the App Store, because it is Canada's free COVID-19 exposure notification app. So basically it'll alert you about maybe possible exposures that you've had with people that you've been near, so that you can get yourself tested before finding out the bad way. Okay, so it's a little bit complicated, but their summary video is really good, so we're just going to watch that real quick.
Our smartphones. We use them to keep in touch, to play, and to work. Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease before they have any symptoms. The Government of Canada has developed an app that will let you know if you may have been in contact with someone who has tested positive for COVID-19. The COVID Alert app creates a random code so that no one will know your name or your location. The app uses Bluetooth to exchange random codes with nearby phones. The code is a randomly generated string of digits and letters that changes every 5 minutes, so it cannot be used to identify you. The app does not have access to your name or address, or your phone's contacts, your location, or your health information. If someone you've encountered later tests positive for COVID-19 and uploads to the app a one-time key they received from their healthcare authority, you'll be notified that you may have been exposed. If you
I'm just going to stop it there, just so that we don't go too long. But Sandy, is there anything else you wanted to add regarding the COVID app? Sorry, Stephanie?
Yeah, so on the next slide, basically, it's just a brief overview if you didn't catch it. So basically, the app exchanges codes, random codes that are unidentifiable and can't be tracked back to you with nearby phones that have the app installed, and they exchange it like every 5 minutes. And then if you come into contact with somebody who later tests positive for COVID-19, they receive a one-time code from their local health authority that they can enter into the app, and then the app will notify you that you've come into contact, or you have been near less than 2 meters apart this person, and it'll basically just tell you that maybe you should get yourself checked out. And the next slide, we could just see kind of what that will look like when you open up the app. And they also said on the next slide, there's a list of privacy policies. So just know that nobody will be able to get any information about you or the time that you were near them, not your location, your name, your address, just anything about you or even your health information. So yeah. And then on the next slide, if you've tested positive, what you do is basically, like I said, you get that one-time code if you're diagnosed, and then you enter it anonymously into the app, and then it'll notify people, and these notifications are based on if you spent more than 15 minutes and less than 2 meters apart from an individual who has tested positive in the past 14 days. They will notify them, and don't worry that your identity will not be revealed. So as of 2 days ago, there are about 6.5 million downloads in Canada, and about 25,000 of these one-time keys for positive users used. So relative to the population of the country, that's not that much, but here are some reasons that you should download the Alert app. So basically, this is just another tool that you can use to help limit the spread of infection and prevent future outbreaks. And the more people who install the app, the better that it'll work. And it's also very easy to download the app. All of the sort of complicated, hard stuff the app does on its own, so that all you have to do is kind of click once or twice a day, and then it does all the work for you. So yeah, and then just know that the COVID Alert app is not replacing medical advice or like any advice from your local public health authorities. It's really just another tool to help you. And then on the last slide here, we have some resources. So there's the info on the COVID Alert app. They have how it works, how many people are using the app, a help and FAQ page. You can share your suggestions on how to improve the app, and you can also contact them there. There's also an eHealth COVID-19 test results page, so that's where you would go to get your results, as well as that one-time code to enter into the app. And then there's just a direct link to their FAQ page, and then finally a link to the COVID-19 Ontario page.
And so that brings an end to today's webinar. We hope that what we shared was helpful for you. And whether you're Garfield looking at Dr. Kearney's website page, or you're using some of the things we discussed to stay in contact with loved ones, we hope that you found something helpful today. Now, this video is recorded and will stay up on our YouTube page forever, so if you ever need to go back, rewatch things, or if you need individual support, you're always welcome to send us an email. Again, that is at drkearney232@gmail.com, and we'll be sure to be able to support you in any way we can to help you reach your technological goals, to stay connected and maximize your own health. So with that, we would like to thank you for taking the time and spending your Friday with us. We have our email listed there. If you ever have any questions or require individual support, please do not hesitate to send us an email, and we'll get back to you as soon as we can. Before we sign off, we would just like to open the floor to any outstanding questions that anyone may have. Does anyone have any questions?
I just want to thank all the presenters for a wonderful presentation. So much to learn, and I'm going to look at this many, many times. Thank you so much, everybody.
Well, that's great. Well, without further ado, I will bid everyone a good night. Thank you so much for joining us, and we hope to see you next Friday as well, where we'll be discussing another topic on how to take care of your own health.